Welcome to Journey to 600. Today we're going to be talking about diabetes mellitus and the values and exercise indications related to diabetes. So first we will talk about just what is diabetes, then we'll talk about the testing and normal values, the difference between hypo and hyperglycemia, and then the exercise indication and contraindications. So diabetes can be either type 1 or type 2. So type 1 is when the body cannot make insulin and the body is insulin dependent, and it leads to hyperglycemia if untreated because your glucose keeps getting higher and higher and the insulin is not there to decrease that glucose. Type 2 is a little different because your body has insulin, but your body doesn't use the insulin correctly. So it's called insulin resistance. It's not able to use that insulin. And again, it can lead to hyperglycemia if untreated because it's not using the insulin to draw down those glucose levels. So just to point out, insulin is what the body uses to decrease glucose levels. So when type 1 and type 2, regardless of whether they don't have insulin or they can't use insulin, they need insulin to decrease the glucose levels. Exercise also can decrease glucose levels. So hypoglycemia is due to too much insulin or exercise. So you can get low blood sugar when there's too much insulin bringing the glucose down super low, or exercise because exercise can decrease those glucose levels. So testing for glucose can be through various tests. First, the fasting plasma glucose test. This is typically taken 8 hours after a patient's last intake of food or drink, hence fasting glucose. So you have fasted and then you take this test. Normal is less than 100 milligrams per deciliter, but a positive test, meaning that they have diabetes, would be greater than 126 milligrams per deciliter. Next is the oral glucose tolerance test. So this is seeing how your body responds to drinking glucose. So this is taken 2 hours after drinking a sugary drink. Normal is less than 140 milligrams per deciliter, but a positive test would be greater than 200 milligrams per deciliter, so that your body is not taking care of that glucose and it remains high. And then lastly, the A1C test. It's a blood test that measures the patient's average blood glucose over the past 2 to 3 months. So this is a longer time span, and normal would be less than 5.7%, but a positive test would be greater than 6.5%. So these values are important to note so that you can determine on boards if the patient has diabetes or not. But specifically, we're typically going to be looking at the fasting plasma glucose test. This is what the patient can take so that we know if there are any exercise indications depending on where their blood sugar is at. So less than 70, they're in a hypoglycemic state. 70 to 99, that is a normal fasting glucose level. 100 to 125, impaired fasting glucose, so that this can be like prediabetes, and it can contribute to diagnosis of a metabolic syndrome. Like I said earlier, greater than 126 is diabetes, and then greater than 180 means they're in a hyperglycemic state and we need their blood sugar to come down. So less than 70 and greater than 180, those are the numbers that we're looking for, but we may not be able to quickly test their blood sugar. What are other things that we're going to see that can indicate they're in a hypo or hyperglycemic state? So during therapy, what are we looking for? Hypoglycemia can present with hunger, sweating, shaking, dizziness, clumsiness, headache. This can also lead to a loss of consciousness. But on the other end, hyperglycemia is going to be polydipsia, polyuria, dyspnea, dry mouth, fruity breath odor, nausea, and vomiting. And polydipsia is increased thirst, and polyuria is increased urination, and hyperglycemia state can lead to diabetic ketoacidosis, and that presents with rapid weak pulse, flushed skin, lethargy, and hyperventilation. They need to decrease their glucose levels soon. And treatment for hypoglycemic state is that they need to eat glucose tablets or a carbohydrate-rich snack. So how does that impact exercise? Earlier we talked about how exercise can decrease blood glucose levels. So sometimes you can have exercise-induced hypoglycemia. It occurs due to strenuous or prolonged exercise tasks. The risk of this can be reduced by an ingestion of a carbohydrate-rich snack prior to exercise in order to compensate for the increased glucose demands and or increased insulin absorption. You want to wait 2 to 4 hours after insulin injection prior to exercising and eat an hour before therapy. So these blood sugar levels are important when understanding when is it safe to exercise. So less than 70, that's hypoglycemia, so you want to avoid exercise and eat a snack and then recheck your levels. Less than 100, you still want to eat a snack because you are at risk for falling into the hypoglycemic state with exercise. So eat a snack and then recheck blood sugar prior to exercise. 100 to 250, it's okay to exercise at that level. Although greater than 180 is hyperglycemia, that's okay. It is not a contradiction to exercise until you get over 250. That is when you want to avoid exercise. So practice question. A patient with type 2 diabetes comes in twice a week to outpatient therapy for balance and conditioning training. During the session, the patient reports dizziness and headache. You note they appear more clumsy than normal. Which of the following should you do? A. Call 911. B. Continue the treatment session. C. Allow a rest break and continue the treatment session. D. Offer a carbohydrate-rich snack. I'll give you a moment to answer this question. If you're not ready to talk about the answers, please pause. So you're thinking, okay, this patient has type 2 diabetes. Now you're probably thinking, well, is it hyper or hypoglycemia? So what is the patient experiencing? Dizziness, headache, clumsiness. So this sounds like hypoglycemia, and you would want to offer a carbohydrate-rich snack to see if that helped increase their blood glucose levels and decrease their symptoms of dizziness, headache, and clumsiness. Giving them a rest break won't necessarily help their blood sugar come back up, but giving them a snack would. Calling 911, this is not a medical emergency, so you would not have to call 911, and you would not want to continue the treatment session as this could continue their decrease in blood glucose. So D is the correct answer. Offer a carbohydrate-rich snack. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.